The respiratory system is important because of its ability for the lungs to ventilate, and in ventilation, when air moves back and forth, we also have what's going on is the exchange of gas. This gas is oxygen in substitution and excretion or exhalation or off-gassing of carbon dioxide, the products of metabolism. It's oxygen that is picked up by the red blood cell that is then taken from the lung, exchanged for carbon dioxide in external respiration. Air passes through the upper airway. This includes the nose and mouth, where large particles are knocked down by nasal air and mucosa. The air is humidified and warmed, taken down through the oropharynx, hypopharynx, and then down through the glottic opening and into the windpipe. As it passes through the windpipe or trachea, it branches into the right and left mainstem bronchus. The right mainstem bronchus is much straighter, as the left mainstem bronchus is much more acutely angled. Air continues to pass through those branches down to the bronchioles and the terminal airways of the alveoli. Around the alveoli is a matrix of capillaries. These capillaries allow for the exchange of carbon dioxide and oxygen. Now, before oxygen makes its way down to the alveoli, everything that does not make it to the alveoli or the lower terminal bronchioles is considered dead space. This oxygen has no way of moving into the cell. So it's just moving in and out without any exchange going on. This is called dead space. After the external respiration, where the red blood cell picks up oxygen and exchanges the carbon dioxide at the terminal airway and alveoli through that capillary matrix, the red blood cell then carries that oxygen down to the cells of the muscles, tissues, organs, and bones for cellular respiration, where metabolism goes on. Metabolism is important for formation of energy, which every cell needs to maintain the function of bones, muscles, tissues, and organs. The airway does change slightly in pediatrics, in that their tongue is much larger and the opening of the trachea, the cricoid ring just above it, is much smaller. So the tongue can block that airway easier, and smaller objects may get stuck in that windpipe. We also need to keep in mind that there's a larger rounding on the back part or the posterior aspect of the head called the occipital protrudence that makes their head so much bigger, causing the airway to be flexed forward, kinking the airway. Maintaining an open airway is important, and therefore we should use the head tilt chin lift if there is no need for spinal precautions, or the modified jaw thrust. This aligns the airway with the oral opening and aligns the tongue and pulls it away from the hypopharynx to allow air to pass through the trachea. We may also use adjuncts such as an oropharyngeal airway or a nasopharyngeal airway to keep the tongue away from blocking the tracheal opening. If there is fluid, besides positioning the patient, we may also use a suction device, either mechanical or manual, to clear the airway of fluids, byproducts of digestion or vomitus, and or blood. Let's recall the minute volume is the amount of air that is taken in one breath. Minute volume is the amount of air taken in one breath. That is called the tidal volume. And we times this by the amount of breaths in 1 minute. So the respiratory rate. If our volumes are adequate, we should roughly come out to about 5 liters. Adequate breathing is passive. We do not see the movement of the chest or an open mouth gasping for air. It's very silent and passive process. Inadequate breathing would then demonstrate a patient having trouble breathing, and they could be leaning forward, they could be breathing with a mouth open, they could have nasal passageways that are flared open, their head in an upward fashion to open their airway. They may not be able to speak in complete sentences, and they may have different lung sounds other than sounding very clear and air easily moving throughout the chest. It's when these patients are having a degree of distress, mild, moderate, or severe, which we will go over, is when you decide whether to assist them to breathe. These techniques would require you to help them to ventilate by using a positive pressure device. The positive pressure devices that we would use to help them breathe forces the air in and down into the lungs so that air can be exchanged. If the person has mild respiratory distress and does not require us to actually ventilate them using a bag valve mask or an Eldervice, which is a powered pressure device, or an autovent, which is an automatic transport ventilator, or more recently the induction of using a continuous positive airway pressure device called a CPAP. We may use passive flow devices called a nasal cannula, a non-rebreather, or a simple face mask. These provide increased levels of oxygen but do not help to force air in or to assist with ventilation. Again, these passive airway devices provide supplemental oxygenation but do not assist in their ventilation. To assist with someone's ventilation, we require you to use a positive pressure device. This would be a bag valve mask, an Elder valve, a CPAP device, or an automatic transport ventilator. Keep in mind, as we use these devices, they require you to use oxygen. And oxygen is a special contained gas in its own pressurized cylinder. It comes with a regulator and regulator assembly. And I need you to make sure that you understand the oxygen cylinder and a regulator assembly in order to deliver the oxygen. When we give oxygen, we may use other determinants called an pulse oximetry, which measures the amount of oxygen flowing throughout the capillary bed. A normal range is above 95%. People with a saturation or oxygen saturation less than 95% may require supplemental oxygen, or if they are not ventilating correctly or need assist, may need to be assisted via a positive pressure device. Please review your skill sheets on understanding an oxygen cylinder, the regulator and regulator assembly, the positive pressure devices called the Elder valve, bag valve mask, and CPAP. Please review your skill sheets for when you're giving oxygen via a passive device called a nasal cannula, simple face mask, and a non-rebreather mask. One other device that we will put out now is called a nebulizer, or a small volumetric nebulizer device. It is a device that aerosolizes medications so that this medication can be delivered directly into the lungs and absorbed in the respiratory tree. Review your skill sheets